Thank you. I have no affiliations to disclose. Urinary incontinence is highly prevalent in nursing and residential care home residents and is associated with high personal, social, physical and economic burden. Mixed urinary incontinence is most commonly experienced by older women, but in the context of care homes, treatment options are limited and predominantly rely on the containment approaches using absorbent products, which are expensive and can impact on a resident's dignity. Transcutaneous posterior tibial nerve stimulation is a non-invasive, safe and low-cost intervention which does not require active participation by a resident and has shown promising evidence of effectiveness to reduce mixed urinary incontinence in adults, including older women. The aim of the electric trial, therefore, was to compare the clinical effectiveness of transcutaneous posterior tibial nerve stimulation and sham stimulation to reduce the volume of urinary incontinence in care home residents. Electric was a multi-centre randomised controlled trial involving residents living in nursing and residential care homes in England and Scotland who experienced urinary incontinence. Following consent and baseline assessment, residents were randomised on a 1-to-1 basis to receive 6 weeks of TPTNS or sham stimulation. Outcomes were measured at 6, 12 and 18 weeks post-randomisation. To enable detection of a clinically meaningful reduction in 24-hour urinary leakage of 200 ml or more, 278 residents were needed. But to allow for potential differences in variability, our target recruitment was 400 residents. The electric population was men and women living in nursing or residential care homes, including those with cognitive impairment, as it was essential not to exclude people with dementia. Our inclusion criteria were that the residents experienced weekly or more frequent urinary incontinence, that they wore absorbent pads to contain the urinary incontinence, and that they used a toilet or a toilet aid for bladder emptying with or without assistance. You can see the exclusion criteria here. The intervention involved delivery of 12 sessions of 30 minutes duration over a 6-week period for both groups. Stimulation parameters were identical, apart from the position of the electrodes, which were sited over the tibial nerve in the intervention group and sited to avoid the tibial nerve in the sham group. The intensity of the stimulation also differed between the groups and was the highest tolerable in the TPTNS intervention group, but was a subtherapeutic intensity of 4 milliamps in the sham group. The intervention and the sham were delivered by the care home staff following an in-depth training programme. The primary outcome was the volume of urine leaked in a 24-hour period at 6 weeks post-randomisation. This was measured using a 24-hour pad weight test. Secondary outcomes included the volume of urine leaked over a 24-hour period at 12 and 18 weeks post-randomisation, the number of absorbent pads used in the 24-hour period at each of the time points, the perception of bladder condition from the perspective of the resident, their family member and a member of staff, toileting skills, which we identified using the Minnesota Toileting Skills Questionnaire, and quality of life. Recruitment took place between January 2018 and August 2019. 408 residents were randomised from 37 care homes in Scotland and England. Primary outcome data were available for 85% and the 18-week follow-up data were available for 71%. So the baseline resident characteristics showed that the residents were old, frail, with high physical and cognitive dependence. The mean age was 85 years and 78% of the participants were female. The mean mini-mental state examination score was 13, indicating severe cognitive impairment overall, and the mean Bartel index score was 7.6, demonstrating high physical dependency. 52% of the residents were severely frail and 27% were moderately frail, but there was no difference between the groups at baseline. In terms of their continence status, the groups were similar at baseline, with 57% having severe urinary incontinence of more than 400 mL per 24-hour leakage. 81% were unable to use the toilet independently because of mobility problems, and more than 40% were unable to communicate their need to use the toilet. All residents wore absorbent pads to contain their leakage. Good adherence to the allocated protocol was found, with 78% of the TPTNS group and 71% of the sham group receiving the full protocol, in that they met the criteria of at least 8 sessions completed using the correct electrode position at the correct intensity of stimulation within the 6-week period. For the primary outcome, the table shows the adjusted linear time comparison models for the total volume of urine leakage and indicates there was no statistically or clinically significant difference between the TPTNS and the sham groups at the primary outcome time point of 6 weeks, or the secondary outcomes of 12 and 18 weeks post-randomization, indicating that the TPTNS had no effect on urinary leakage in these residents. For the secondary outcomes, there were no significant differences between TPTNS and sham groups at any time point for the number of absorbent pads used, the perception of bladder condition by the residents or the family members, the residents' self-rated skills for using the toilet, or for quality of life. Statistically significant improvement in staff-reported perception of bladder condition was found at 6 weeks in the TPTNS group. However, the difference was small and unlikely to be clinically meaningful. Staff ratings of the residents' toileting skills at 6 weeks and 18 weeks were also significantly better, but for the sham group. However, again, the minimal differences reported were not considered to be of clinical importance. There were no reported serious adverse events related to TPTNS use, and no safety concerns were identified. So to conclude, the electric trial showed that in the care home context, with a high proportion of older residents with poor cognitive capacity and limited independent mobility, TPTNS was not effective in reducing urinary incontinence. There was no evidence of a beneficial effect of transcutaneous posterior tibial nerve stimulation on any continence-related outcomes or resident quality of life, despite adherence to the protocol by the care home staff. We recommend that analysis of the potential role of care home contextual factors to explain the results is needed. Thank you for listening.